Hi, Nathan Ritter from cardiogauge.com. This video is about CBD and the heart. Cannabidiol is an extremely commonly used supplement. Something like 30 million Americans have used it at some point. And it's a multi-billion-dollar a year industry, so there's tons of hype in business and financial terms. And a lot of my patients are asking me about it. Can they take CBD with their heart medications, for example? Could they use it to treat or prevent heart disease? So I decided to make the video. The most common use for CBD is pain. Something like 40% of people who use CBD use it for pain, but it's also used for anxiety, insomnia, inflammatory arthritis, and acne. But how about CBD and the heart? Well, CBD does indeed have proven effects on the cardiovascular system. First, let's look at the preclinical work. That means study of CBD in animals, test tubes, that type of thing. Animal studies show that it protects blood vessels from damage due to high blood sugar, protects the heart from damage when blood flow to it has stopped, it reduces blood pressure response to stress, and it decreases platelet clumping, which can decrease the chance for stroke and heart attack. So there clearly is some science that shows it could be helpful in preventing or treating heart disease. How about studies in people? Animal studies give us clues that treatments could work, but only with human studies can we actually know. Human study in the heart space here is really shockingly limited. I have only one study to tell you about. A single dose of CBD reduces blood pressure in healthy volunteers. 9 men got 600 milligrams of CBD or placebo, and the CBD decreased the blood pressure 6 points and increased the pulse 10 beats per minute. The effect lasted from 30 minutes after taking it to about 2.5 hours after taking it. This suggests CBD decreases pressure, but it was only a single dose study and the effect was brief, so it's unknown if tolerance would build up over time and effect would decrease. If you have experience with how CBD affects your blood pressure, please comment below. I want to hear about it. On to side effects. The main side effects relate to the study I just talked about. It can decrease blood pressure and increase heart rate. So somebody who has trouble with low blood pressure, it might get worse if they took CBD. Low blood pressure problems are like lightheadedness, feeling like you're going to pass out, weakness. So somebody who has low blood pressure and those symptoms, that could get worse with CBD. Also, it could increase heart rate in somebody who already has trouble with palpitations or a high heart rate. Occasionally, I see patients with those issues, and you might think that CBD could make that worse. On the other hand, though, because CBD helps with anxiety, people who have high heart rates related to anxiety might have their heart rate decrease with CBD. So that would be a variable side effect in a person who had trouble with heart rate. The other standard CBD side effects are fatigue, weight change, diarrhea. So those could certainly happen in anybody who used CBD for their heart. Let's talk about medication interactions. CBD and grapefruit have similar effects on medications. Numerous heart medications interact with grapefruit, and here's a table with a list of common medications and alternatives which would generally be okay with grapefruit or CBD. This is not an exhaustive list. So basically, there are some very common medications on this list, and you really have to be aware of potential interactions if you're starting CBD. It is a legitimate concern. Unfortunately, when you ask your doctor about medication interactions and CBD, they're basically probably not going to know. They're going to Google it, and then they're going to read about how this doctor at the Mayo Clinic recommends that what you should do is ask your doctor. So it goes around and around. Basically, the key is to know that CBD and grapefruit have similar interactions with medications. So you can look up and see how grapefruit interacts with your medicines and have some idea of how CBD would interact with them. Let's go over some potential uses of CBD in people with heart trouble or people trying to prevent heart disease. In my mind, the most obvious potential use is for treating pain in people with prior heart attack or stroke. People with chronic, uncontrolled pain can't exercise. They have poor quality of life and are depressed. Ibuprofen and similar medications are amazing pain meds that can help a person avoid addictive psychoactive opiates like oxycodone. When somebody has blood vessel disease like prior stroke, heart attack, or stent, though, ibuprofen is off limits because it increases blood pressure and the chance for a heart attack. So, how about using CBD in place of ibuprofen for these people? If you have experience using CBD to treat pain in place of ibuprofen, please comment below. However, Because CBD likely significantly affects clopidogrel and ticagrelor, which are commonly used medications after heart attack, it's critical to get good advice about whether or not it's okay to start CBD in that setting. A second potential use for CBD in the heart would be to decrease blood pressure in stressful situations. For example, when people come to my office, they're oftentimes pretty stressed out and their blood pressure is higher as a result. I wonder what would happen if they took CBD before the visit. It might make their blood pressure better. A third thing we can all wonder about is using CBD to decrease inflammation and decrease the risk of arterial disease as a result. However, CBD effect on inflammation is not well studied at all in humans. It's great in animals, but that simply isn't enough to inform us what to do here. So in conclusion, CBD is not well studied in the human heart and blood vessels. Limited study shows decreased blood pressure of 6 points with 600 milligram dose of CBD lasts about 2 to 3 hours. CBD seems like a good alternative to ibuprofen and other similar pain medications. And while CBD in general appears to be safe for most, interaction with medications is important and you have to do your research. Thanks for watching. I look forward to your comments and questions below. Please hit like and subscribe for more content. See you next time.